Good afternoon, everyone. I'm Governor John Carney. Thank you for joining us today for our weekly press conference on Delaware's response to COVID-19. We have a whole team for you today. Joining me is the Secretary of the Department of Health and Social Services, Molly Magarik. Thank you, Molly, for being with us. I think this is your first time since taking over the reins there at Health and Social Services. So many important things that you and your people are doing as we respond to COVID-19. Also joined by Cerron Cade, who's the Secretary of Labor. Again, significant activity in the Department of Labor, getting those checks out and taking the applications for unemployment benefits for the CARES Act response monies that have been distributed to our state. I know it's been a challenge for your people and making sure that Delawareans get the resources that they need to stay afloat. And then, of course, one of the regulars, A.J. Schall, who's the director of the Delaware Emergency Management Agency. A.J. has been the point person for our testing efforts and is going to give us some updates on some of the changes underway there and maybe some of the challenges that we face and some of the outreach that we're doing for higher education and schools going back, reopening for the fall. We do have a lot of challenges, most of which we've anticipated. You know, if I look back over the last 6 months, we really had no idea what laid ahead of us. So when we saw our first positive case in March 11th, declared a state of emergency the next day and have been working our way through this pandemic with the advice of the Centers for Disease Control, the NIH, following the science and the data, learning more about a pandemic science and public health principles. We've got a great team here. We got great partnership with Delaware's hospitals early on as we saw a real spike up in the number of hospitalizations, and most of the testing back in those early days in March and into April were done and conducted by our hospitals in the 3 counties, and just a great partnership there. We had a significant challenge with the outbreak in the poultry industry in the lower part of our state, something that obviously we did fear and anticipate, and we were able to, I think, as I've said several times before, as we look back there on this experience of the last 6 months, one of the things that will stand out is the outreach we made in testing thousands of poultry industry workers, their friends and families in the neighborhoods in which they lived, and staying on top of that after that. And then, of course, we saw the outbreak as summer started in mid-June and into early July. The beach communities along Atlantic City and Atlantic and Bay beaches here in Delaware, and had to react to that, and particularly among workers in the hospitality industry, bars and restaurants. And we've continued to see some challenges there, although it's leveled out a little bit. And then, as we expected all along, and as has been occurring in college towns across America, and I'm sure you all have been reading about it in the news, it's been prominently reported in the news over the last couple of weeks, is the outbreaks that we've seen in universities and colleges and in college towns across America. And we're seeing that now and starting to see it at the University of Delaware and Delaware State University here. In our own state, we've got meetings this week, and we've had several meetings leading up to the reopening with the presidents and the administrations at University of Delaware and Delaware State University. We've got a great partner, AJ, in the city of Newark with respect to some of the restrictions that we've put in place. And most importantly, I think it seems that both out of combination of complacency and just ignoring the public health restriction and guidelines among the student populations as those students have come back to town, that enforcement increasingly is going to be an important part of containing the spread of the virus. You'll see today as we go through the numbers that our numbers are trending up. I've been saying for the last month that we're not bad and we're not good. We're kind of in this middle area of where we want to be better than we are, healthier than we are. we're on or off quarantine lists in our neighboring states of New York, New Jersey, and Connecticut. 1 week we're on, next week we're off. Now we're back on, and that's because we've seen a spike in cases in our university towns, in our college towns, Dover and Newark, and in some of the areas, again, in Sussex County, where we see less compliance with mostly face coverings, mask wearing, which is the most important thing that folks can do to protect themselves and mostly others from the spread of COVID-19. So we have a lot of work to do, and we will lean into that work this week as we meet with administrators and law enforcement agencies connected with Dover and Newark, as we lean into our messaging in other communities. We're getting our children back to school. Most are learning remotely at the moment, preparing for a conversion into more of a hybrid model, which is present in almost a half dozen districts, mostly in the lower part of our state. Most of the private schools are a hybrid with a mix of remote and in-person instruction. So we'll continue to work on that. And as I think about our challenges with respect to preventing the spread and the increased number of cases among college students, if you think about it, being complacent, not following those restrictions in Newark and Dover and other places means that it's going to take us longer to get their younger brothers and sisters back in classrooms in front of teachers, because our numbers are going to go up as they are gradually. Percent positives are going to go up, and we're going to have to be more cautious about those learning environments in person with teachers. So let's go to the data. We're almost up to 20,000 total positive cases now over the 6 months since the onset of COVID-19 back in March. We're up a little bit on total lives lost. Everyone is obviously precious to us and to the family members there. Hospitalizations have ticked up from, we got a low of about 38 under 40 a couple weeks ago, and it's been up and down a little bit over the last several weeks. We're up to 61 today. It's way below our capacity to provide service to those patients, but obviously an indication of the severity of the virus for certain populations. If we look at, this is the most concerning here, you know, as we've been saying for months now, our World Health Organization target on percent positive is 5%. We've been comfortably below that. The green scenario for going back to school is at 3% positive, and so we're moving away from that. So that goes back to the message of a minute ago, which if we want to get children back in front of teachers in schools, we need to drive that percent positive number down to 3%. The new cases per day were way above the gating criteria for a green scenario and school reopening. We're about not quite 10 cases per day above the quarantine gating criteria for our surrounding states. We want to be below 90 and ultimately much lower than that. And so again, we're seeing a combination on the percent positive that the number of people getting tested is going down, so the denominator's getting smaller, and the number of new cases is going up. And so it's driving the percent up from in the mid 4%, AJ, to 7.1%. Each of the days, each of the last 4 days have been above 4% positive, and that's not a good thing. As we talk about the individual cases per county, we're approaching 10,000 positive cases in Newcastle County, Kent County at 2,800, about consistent with the population percentage there. And again, too many cases in Sussex County at 6,500. Just to review quickly, the rate of positive cases per 10,000, and so this is where you see the real the high level of cases in that 18 to 34-year-old demographic, 289 cases per 10,000, higher than any of the other criteria, or the other demographics. The next one is 35 to 49 at 265. And so we really need to do a better job. It's a young adult crowd. It ought to be a responsible crowd. It's a lot of folks that are in our colleges and universities that need to be more attentive to following the rules and protecting one another, frankly. And mostly it's off-campus social activities, partying. Anybody who's been to college knows what I'm talking about, and difficult to change that behavior, but something that we really need to do and lean into. Here's our data dashboard over the last 14 days. We want all those graphs to be heading in a downward trajectory from left to right, and you can see most of them are flat. Our new hospitalization admissions continues to go downward. Our percent positives, as you can see, is going the wrong direction. We had it down around 4%, and now it's over 7%, and we need to do much better than that. And then new positive cases are going up gradually. We've had a couple spikes, again, associated with some of this activity that we're seeing. We've tested significantly in the get back to school population. AJ, I know you're going to talk about that, and that's looking pretty good. It's really in the social environments, in the student populations in Newark and in Dover that we need to get our arms around. If you look at the 90-day view, again, you just have a more comprehensive look at the ups and downs, and you can see things more recently trending up a little bit, which is exactly what we don't want to do. We're still in good shape with respect to personal protective equipment. We did have some concerns about that moving into the start of schools, but so far that's holding pretty steadily. And I know, AJ, we've been working on making sure that we had a good stockpile of all those protective equipment. You might comment on that when we get to your piece on the testing. If you look again at the current status of our school reopening, we're clearly in the yellow scenario, which is a hybrid of in-person learning and remote learning. Most school districts, as I said, are learning and teaching remotely, much better than they were in the spring, and we compliment teachers and parents for leaning into that. The goal, obviously, is to have more children in classrooms in person. We're not going to get there if these numbers keep going up. The percent positive, this is a different interval, and that's why it's a little bit better than the 7.1%. But again, we're still here above 5%, need to be under 3% to be to light up the green scenario and have greater safety in bringing children back to school. You'll remember that we announced a $25 million support fund for the nonprofit organizations to those that have provided critical services to Delawareans and Delaware families through the COVID-19 pandemic. If you are one of those, most of you have contacted us or have been contacted, and so you know who you are. But if you need more information, you can get it at de.caresfund.org. That's de.caresfund.org. And with that, I'm going to turn it over to Secretary Molly Magarik, who's going to talk about a very interesting and I think important positive thing in developing an app for our iPhones that would enable us to keep track of people that we come in contact with if they're COVID-19 positive. Secretary Magarik.
Thank you, Governor, and thank you, everyone. Happy to be here with you today. And I'm really excited to announce the launch of an important new tool for fighting COVID-19 that is going to rest in the palm of your hand. It's a free, anonymous exposure notification mobile app that's called COVID Alert DE. And COVID Alert DE is going to use Bluetooth low-energy technology that is provided by Apple and Google, and it's going to alert users if you have come in close contact, which we define as less than 6 feet, for 15 minutes or more with an individual who has tested positive for COVID-19. And the app is going to allow users to also log their symptoms every day, which is going to help them be able to check back and review that list at any time, including if they're called by a contact tracer who is going to ask them about the symptoms they have or haven't been having. And we also are working to be able to put data and information into the app that'll help people keep up to date on the fight against COVID-19 in Delaware. And the app is going to be available to anyone 18 or older with an Apple or an Android phone who lives, works, or goes to school in Delaware. And we strongly encourage you to download COVID Alert DE from the app or Google Play Store today, and we want you to use it. And we're going to do a brief demonstration for you all so that you can see how it's going to work.
When you open the COVID Alert DE app for the first time, you will be prompted to select your age. If you are under the age of 18, the application will thank you for your interest and inform you that you do not meet the age requirement to use the app. If you are over the age of 18, the application will take you to the onboarding screen. Here you will review the 3 key features of the application: exposure alert system, symptom check-in, and updates. Privacy is paramount to the COVID Alert DE application. On the next screen, you will review the data privacy policy and have the option to submit anonymous app usage statistics. You can review the data and privacy policy anytime online. Next, you will be prompted by COVID Alert DE to enable the Exposure Notification System, or ENS, on your device. During your first COVID check-in, the application will ask you a series of optional demographic questions. Any information you choose to enter will remain anonymous at all times. Once every 24 hours, you have the option to perform a daily COVID check-in. This anonymous information can help you keep a record of symptoms or changes in your health that you may be experiencing. If during the COVID check-in you record any symptoms that may be related to COVID-19, you will be presented with recommendations and links to additional information about COVID-19 from the Delaware Department of Public Health. COVID Alert DE also provides updates on the fight against COVID-19. If the exposure notification system detects that you may have been in close contact with someone who has tested positive for COVID-19, your device will generate an alert and prompt you to open the COVID Alert DE application for further information. If you have tested positive for COVID-19, a member of the Delaware Contact Tracing System team will reach out to you. During the interview process, they will inquire if you have the COVID Alert DE app installed and if you would be willing to upload a 6-digit code that allows your phone to share special anonymous keys, which are random numbers that change every 10 to 20 minutes running in the background. Once you upload the code, the app can now work with the ENS on your device to upload the anonymous keys. The app does its work in the background, checking your phone's keys against keys from other phones it has been near since the date they were tested. If there's a match, COVID Alert DE alerts the individual. Download COVID Alert DE free in the App Store or Google Play Store.
Great. Well, as you just saw through that demonstration, the COVID Alert DE app uses random Bluetooth keys that change every 10 to 20 minutes. And phones that download the app share random keys anonymously with those who are in other phones that are in close proximity to it. If a person tests positive for COVID-19, the results are verified by the Division of Public Health, and if the person has the app on their phone, contact tracers will give them a 6-digit code that they choose to enter into their phone. If the COVID positive user decides to enter the code into their phone, it triggers their phone to upload special keys. And those anonymous keys are checked against the list of random keys that they have encountered on other users' phones over the last few days. If there's a match, the COVID Alert DE app will then send an exposure notification alert to those individual app users, taking into account the date and the duration of the exposure. If you receive an alert on your phone, it is recommended that you follow the Division of Public Health advice included in the app, which includes staying home for 14 days and self-quarantining, getting tested at one of the many sites that Delaware has provided for free COVID-19 testing, and wearing a face covering if you're in your home and can't avoid close contact with family members. And we also always recommend, if you have questions, reaching out to your healthcare provider for further guidance. So in looking for a solution like this, one of the foremost considerations for the state was the privacy of people who would be using the app. Excellent, thank you. And so I want to assure everyone today that no location data is used or collected by the COVID Alert DE app. Again, the exposure notification system works through Bluetooth low energy technology. And so phones that have downloaded the app recognize the app and the keys on other phones when the phones are in close proximity to each other. So again, it's closeness of the phones, not location, that is detected with these apps. And so to be more specific, the COVID Alert DE app will protect your privacy by not collecting or sharing any personal information such as name, address, or age that can identify you. Again, we are not using GPS, navigation, geocoding, or any other location services as part of this app. The app cannot be used to track you. The app does not know whether you are supposed to be self-quarantining or self-isolating. And the app does not know any personal details about the exposure alert that was sent to your phone. And so since we do not know who you are and the app does not know who you are, it cannot reveal your identity at any point. Next slide. And so why was this important? Why did we want to bring this tool to Delawareans? Knowing about your potential exposure allows you to self-quarantine, get tested, and reduce potential exposures to friends, family, coworkers, or fellow students, as the governor outlined, where we're seeing some of our case growth. And typical contact tracing relies on an individual being able to successfully name all of the people they came in contact with, including contact information for those individuals. And we also ask them how long they've been around someone. And in many cases, unfortunately, the COVID positive person may not have those details to provide to contact tracers. This is especially true in large gatherings or public settings where, again, you may not know the person that was sitting next to you or that you were conversing with at a party. And so using this app will help us speed up the process of notifying close contacts and even identifying close contacts that may not be known to the COVID positive individual. And a final benefit of the app is that our app, COVID Alert DE, utilizes the same technology as those apps being considered by surrounding states. And so that interoperability and the ability to have the same product and technology be used across state lines, we think is incredibly important. And we're really excited to be joining a handful of states that have utilized and are deploying this technology to help in the fight against COVID-19. But the important part is we need people to download the app, which again is available today in the Google Play and the App Store. And we want you to use COVID Alert DE if you are living in Delaware and you expect to be tested in Delaware, because the testing results go to the state that you provide at the testing site. So while we have seen a bit of an uptick, we are grateful that our positive cases and hospitalizations are relatively stable, but we know at any point that trend could change. And so the more Delawareans who are aware of their COVID-19 potential exposures, and we're more likely to be able to keep transmissions low, protect people's lives, and keep our economy and education systems moving forward. So again, we urge you to download this free anonymous app by going to the app or Google Play stores, and additional information is available about COVID Alert DE by going online to de.gov/COVID Alert. And for next slide. We do have prepared, thank you to our wonderful communications team in partnership with the Office of the Governor. We have created marketing and other materials, so for any businesses, nonprofits, schools, or anyone who's interested in partnering with us on greater marketing and helping the people you serve and the people who work with you know about this app, we urge you to email dhss_townhall@delaware.gov. And as always, any general questions can be directed to dphcall@delaware.gov. So thank you, Governor. And again, hope everyone downloads the app and starts using it today.
Thank you very much, Secretary Magarik. This is a really significant breakthrough step forward for us. It will become an important tool to enable us to achieve the objectives of contact tracing. If you think back with respect to the way we've approached and responded to COVID-19, as COVID-19 started to spread and we didn't have the capacities to test, we tested people who were symptomatic. We told other people to stay at home so they didn't come in contact with somebody who might be positive. We didn't know the extent at the time of the asymptomatic spread that we would ultimately see. And so we essentially used our contact tracers, individuals who called an individual who registered a COVID-19 positive test, and then got in touch with others who who that person remembered that they came in contact with within 6 feet over a 15-minute period of time. Well, that's difficult for anybody to remember. So here's a tool that helps the person who tests positive, completely anonymous, that others that they may have come in contact with that they don't remember will get pinged and will be alerted that they, anonymously, by the way, that they should think about quarantining and getting tested as well. Plus, it helps you know that you're at risk because you've come in contact with somebody within 6 feet for 15 minutes that is tested positive, and is triggered by the person who tests positive through the public health system. And so there's the control there. What we need to be clear on, though, is it's not going to include everybody because everybody's not going to voluntarily adopt it. And so all the other things that we talk about, wearing a mask, keeping social distance, making sure you get tested from time to time, particularly if you think you're at risk or exposed, are important to do. Not just if you have the app and you haven't been pinged, but it's important to wear that mask at all times. And very important, this will be an important tool for University of Delaware and Delaware State University. And to the extent that we have other states join with similar technology, that we'll be able to use it for them as well. And so next up, we have Secretary Cade, who's going to talk about additional benefits that have been made available through the federal relief efforts. Secretary Cade.
Thank you, Governor. As many people are aware, the federal government established the CARES Act earlier this spring, which established a handful of unemployment programs that provided added benefits to individuals who were on unemployment. That program has expired, and it expired at the end of July. Since then, President Trump has issued an executive order or a memorandum, I think is probably a more appropriate way of putting that established the Lost Wage Assistance Program, which each state had to apply for. Delaware applied and our application was successful. And this program is going to provide an additional $300 of temporary benefit or assistance to eligible unemployed workers. It's going to be retroactive to August 1st of 2020, which is the same week that the original programs expired. You can go to the next slide. You don't need to call or apply separately for this program. It will be automatically attached to your unemployment benefits, so you don't have to worry about that. The initial payments will be separate, but going forward, we're going to work to figure out how to make sure that they're combined in one. Individuals to qualify for this payment must have at least $100 in weekly benefits issued by the state of Delaware. Claimants must also certify that their employment has been disrupted due to COVID-19, which is an essential component to this. We have about 20% of the individuals who collect benefits from the state of Delaware who their unemployment is not considered COVID-related. Also, claimants must be eligible for benefits during the period of the program. So if you collected benefits and your benefits expired or stopped for whatever reason, after these dollars have already been expended, obviously you would not be entitled to those funds. Next slide. We also wanted to make an announcement regarding the Pandemic Emergency Unemployment Compensation Program, which essentially is extended benefits. So as a part of the CARES Act, the federal government, Congress, and the president signed off on PEUC, which provides extended benefits beyond Delaware's 26 weeks of unemployment. Originally, when this program was established, we had it situated where your benefits would pick up, your extended benefits would pick up immediately after your unemployment expired or exhausted. Now we have to direct people to the Pandemic Unemployment website, the new website that we had established for these federal benefit programs. You're going to have to reapply there. The way the system is essentially going to work is that as your benefits come to expire, you're going to receive a letter from the Department of Labor alerting you to to your benefits exhaustion date. Once you receive that letter, it would also encourage you to apply for extended benefits through the PUC program. Individuals who would be looking to apply would have to go to the website that you see on the screen, pua.delawareworks.com. It is a secure website, so if you go to www.pua, it won't come up. You have to either put it in the exact way that you see it here, or you have to add the https:// for secured websites. But it's easier if you just plug it in the way that you see it here on the screen. Notification, again, will be mailed to you once your claim is about to exhaust, so you're coming up on your 26 weeks, and you will have to go to this website to apply for your extended federal benefit. You'll have to go establish or activate your account and apply, and you'll have to do your weekly certifications from that website. You'll no longer be utilizing the traditional unemployment website when you do. You can go to the next slide. Just to give you some insight or some brief update, these numbers are solely individuals who qualify for the federal benefit. The total number of individuals who've received unemployment or have applied for unemployment benefits is over 100,000. The 82,000 number is solely for folks who are COVID related, we're classifying it as. We've paid out a total of $560 million in federal CARES Act unemployment benefits to that population. In total, we're around $760 million once you factor in the state unemployment benefits and the other individuals who are in that pool. So currently, we're almost at $800 million, very close to, and have served over 100,000 Delawareans to this point. You can go to the next slide. Also, just to briefly mention, the governor also established Executive Order 43, which is a rapid workforce training and redevelopment initiative that we've actually started rolling out, and application deadline for that is September 25th. And mind you, that application deadline is not for individuals who are looking to apply for training. That is for training providers and large industry groups who are looking to train up their workforce to connect them with, or to train up our workforce of individuals impacted by COVID to connect them with job opportunities. Applications are going to be reviewed on a rolling basis, but again, since these are CARES Act dollars, we have to get these dollars out of the door by the end of the year. We expect for a majority of the training, if not all of the training, to be completed by the end of March of next year. So a very lofty goal, but with the partners that we've been able to establish through the Workforce Development Board, we're extremely confident that we're going to be able to do a heck of a lot of good for a heck of a lot of people who are going to be looking to get back into the workforce next year. You go to the next slide. Thank you,
Secretary Cade, and so if you're looking for that step up for high demand jobs in our workforce, that rapid workforce training program is something for you. You can get information about it at de.gov/relief. Thank you, Secretary Cade, for everything that you're doing, and your folks there at the Department of Labor. Lots of demands on their time with the outreach necessary to serve so many thousands of Delawareans over the last 6 months. AJ, I know you've been busy. Could you comment just briefly about PPE, how we're doing with our stockpiles, and whatever else you want to share with us with respect to new testing programs?
No, thank you, sir. So PPE, I think, is something we have worked on quite a bit with Dr. Tate's team at Public Health over the last several months. We've had great partners with our Government Support Services team to be able to support and really go out and find what we think we need going into the fall to really be the backstop for our first responders, for the long-term care facilities, and for the hospitals and clinics that will continue to operate if and when they come into a hurdle. So we have, built the stockpile back up. A lot of that was pushed out early during the pandemic in the spring. And we continue to source orders and stock stuff up. So when we talk about this, we're talking about the surgical gowns. We're talking about gloves for medical procedures. We're talking about N95s or surgical masks, so the medical grade equipment, and continue to, little by little, just build up that stockpile. Hopefully in the fall we won't need it, but we're going to be ready if we are to assist our partners across the state. So that going into testing. So at the end of May, if ever, as the governor alluded to earlier, we started off this, pandemic with only testing individuals that were symptomatic. And there's supply chain issues, there's testing issues, there's that, the capacity and, hurdles that we had with our partners through with the hospitals and the private industry just to get that number up. So middle to end of May, we really came together with a strategic plan across the state, which used local providers, the hospitals, and as well as the state to step forward and try and reach that 80,000 number a month that we've talked about. We've been short. We did have a high water mark just around 60,000 2 months ago. And as you've heard me say for about the last 6 weeks, our numbers have been decreasing in the community testing sites. We've been going from about 15,000 individuals a week closer to about 10,000 the last several weeks. We did see a little uptick 2 weeks ago and last week with schools going back in session, both in some Sussex County and the private schools as well that were really helping with our outreach and in sharing the importance of testing. So what we've done starting this week is really pivot a little bit from these road shows, which we were averaging anywhere from about 14 to 18 different testing events across the state a week. Usually we're doing it 6 days a week with the assistance of Newcastle County, to really 19 permanent locations throughout the state. And these are made up of Walgreens, service centers, so the state service centers, and the public health clinics across the state, a variety in each county that will at least have hours during business hours, Monday through Friday. Some of the Walgreens do have Saturday and Sunday hours for their pharmacies, and that varies by location. So we have longer hours, consistent places. So this takes away the fear of somebody that wants to get tested on Monday, but there's not at a community event that's coming till Thursday or Friday. There should be something that they could get to sooner rather than waiting until something pops up in the backyard. We've been working on this probably for about the last 4 to 6 weeks, and public health and Dr. Cade's team, Lisa and others, really identified where are the best place to put these locations, knowing that Walgreens was going to help us with some, and then we were going to lean on these other state centers that we already had. So they looked at where the infection rates were, where we were getting response to testing, the community vulnerabilities that we wanted to overlay. So there was a layered approach to make sure we identified places where we knew people needed access and needed easily to get tested. So the locations right now will not be changing, as much. We are still going to have the road show. It's going to be a little bit smaller because we're using some of that labor pool that has been going to the different schools or church groups, et cetera, to do these testing events and moving them, into some of these service centers to assist. So we will still be doing community testing, I think, the next slide, but I'll go through this at first and talk about the at-home testing kits. The other layer, so we're going to have the permanent testing locations, pop-ups will continue, and we have the schedule at the end, and then at-home testing kits, which we launched last week. A month ago, we were asked to test all the faculty and staff for the schools before they went back in. We entered into a partnership with a lab that was able to do at-home tests. Somebody went online, we provided a URL, they registered, they got a test sent to them at their house, they self-administered the test, mailed it back in, or dropped it in a UPS overnight box, gets their results emailed to them within approximately 48 hours. Had great success with that. We expanded that starting last week on the Get Tested website. Right now, we're prioritizing Delawareans over the age of 60, a vulnerable group that we know. We're identifying zip codes that public health is looking at, knowing that there might be a greater need for testing there, and that's going to rotate. Right now, I'll tell you, we're not running up against a capacity issue. With this, we'll be able to do over 1,000 on-demand URLs a day for people to get kits, and we're going to make sure, as we build this, we use it as smart as possible. We are you must be a Delaware resident to get the kit or work in Delaware, the two caveats that we'll have there. And again, you could go to de.gov /home test to register for that. That is a little longer process because if you register today, you should get the kit tomorrow or Thursday. You have to mail it back in. So, it's not something that we want somebody that has a high risk level to, rely on, but that is for those that know they don't have a known exposure. Maybe they're traveling in a week or so to see family and they want to get a test. If you have that time frame and that flexibility, it's a great backstop where you don't have to then go into a clinic or the Walgreens and something. You can do it on your schedule as needed. So here's just a snapshot of where the 19 permanent testing locations now are across the state. Again, these are a mixture of Walgreens and state service centers and the public health clinics, all at least 8:30 to 4, Monday through Friday, as well as hours on the weekends. 8 Walgreens, 5 service centers, and the 6 public health clinics. These are all self-administered tests, so they're either the saliva-based test that we've been using or a nasal swab that is not the the brain tickler, as people were calling it earlier in the pandemic. It's just the outer nasal swab that you're doing. But individuals do it that themselves, put it in the kit, hand it into the staff, and it gets sent off for tested. Then most of our turnaround times are right around that 48 to 72 hour mark now. So we've been very stringent to making sure that we get this turnaround as much as possible. This also helps us really spread out and use multiple labs to make sure we don't overwhelm just one. So that's the the static testing sites, and again, the pop-up testing locations will continue this week. Tomorrow we'll be at Eastside Charter in Wilmington, Kingswood Community Center on Thursday. St. Francis has a walk-up event as well on Thursday. Seeds of Greatness over in Newcastle on Friday. Another Newcastle County site that's not on here yet is going to be Newark High School on Monday. We're still finalizing the hours for that, but we know the community has a demand there for testing with seeing a little bit of increase there with the university back in session. We have the Hudson Service Center that's right outside Newark that is available Monday through Friday, but hopefully we'll have a site that's easy for people to drive through and get several hundred people through there on Monday. And then right now in Kent and Sussex, we're keeping our Georgetown sites. They're kind of in the hubs, one in Dover's, one in Georgetown. And then as public health identifies other areas that need testing, move those weekly sites around Kent and Sussex County. So, if you go to the de.gov/get-tested, more options than we had last week. We've made the promise to, the governor and our citizens across the state. We are going to analyze this, make sure we're getting people tested that need to get tested, and, continue to push the envelope and come up with new and exciting ways to hopefully get people back to work and open up the economy better.
Thank you very much, AJ, Director Schall. Obviously, this is one of the most important things that we're doing in responding to COVID-19, making sure everybody gets tested. And so we're going to have 19 locations, several new partners. If you remember from the beginning, going back to March, we only had hospital sites. I think the most we had at any given time were 6. We were only testing people that were symptomatic, had to have a script as they came in here. Now we've been testing thousands since then, and at least for the last several months. We've peaked out, I think, 60,000 per month. We've come off that a little bit of late as people have gotten a little bit complacent. Obviously, if you're not symptomatic, you don't really feel the urge or the need to get tested, but you never know. Now, if you sign up for the app and you get pinged that you've come in contact with somebody that's positive, obviously you're going to want to get tested. This is a great tool. So really a strong development today that we're announcing that will enable us to improve the contact tracing effort that's underway with live bodies and to alert people that they might be at some risk. So with that, I'd like to open it up. We've got press in the room, as well as some pre-submitted questions. Meredith, thanks for joining us again. The floor is yours.
So I wanted to start off with the increase in the percent positive, and you mentioned just the college students attributing to that increase. What do the universities, specifically UD, need to be doing that they might not be doing right now in terms of seeing that increase?
Yeah, so that's something we're going to be talking about. First of all, let's talk about the numbers, right? First of all, we were getting a lot of positive cases from the university, and because of a glitch in the system and their own testing, we weren't getting all the negatives. So that was affecting the percent positives. And we're not getting as many people tested, as you could see from the numbers. And we did some reverse math before we came down today, and the number that we came up with, 1,400 tests with the number of positives at 103, I think it was 7.1% over the period, shows you that number, that denominator number is lower. But so is the numerator at 103. We want to be below, in the low 90s and below. And so we're seeing a little bit, are they dramatic increases? No, but we're seeing specific off-campus parties, not surprisingly. I'm not going to ask you about your college days, but that, and it's not just Delaware, it's every college town in America. Just look at the news on the TV, read the papers, and that's what you're seeing. So we collectively have to figure out better messaging. Number one, consequences in the communications, and AJ might want to talk about this. He's been heading up the conversations among law enforcement. So you got Newark Police Department, Dover, in the case of Dover, of DSU. You've got Delaware State Police, lesser role. You've got University of Delaware Campus Police. And then you have civil citations. And you've got university sanctions. Guess what? The students care more about university sanctions, which end up in their parents' hands, as opposed to a citation from the city of Newark that their parent never sees. So we need to think through that. That's one of the things. And we need, as Dr. Asanas, in my conversation with him the other day, talked about other universities, and I saw it in an article, I guess it was, Indiana University, where they sent kids home, 33 kids they sent home. And I think it's that kind of messaging in order to get the message across that it's not just about you and your party and your 20 friends or 30 or 40 friends. It's about the community. It's about getting children back in schools by pushing those numbers down. So to your question, it's that coordination, and we continue to have conversations on the law enforcement side. I think it's going to come down to enforcement. The indications we're getting, it's not as much the controlled environments of bars and restaurants that we are restricting in terms of bar service, in terms of capacity of people in the restaurant at a given time. It's more these off-campus. And some of the outbreaks we've had, the interviews that the contract tracers have, we had a big party, blah, 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 it was involved these kinds of students. Some associated with sports teams, and we're going to get the coaches and the athletic directors together and say, hey, look, we need your help on this as well. AJ, is there anything you want?
The only other thing is I'm going to give credit to Jamie Mack. Jamie's been working with the university communities and really having these weekly coordination calls. We've stepped up the tempo a little bit. I had a follow-up call yesterday to check in on the weekend down in Newark, and he's really pulled a lot of partners together because it's messaging, it's education, and there's a ripple effect if everybody goes inside. If it's a bar issue like we saw at the beach, then the people are just going to go inside, and it doesn't stop the spread. So it's really the education that has to be the foundation, and as the governor said, finding that right. The important message where people are actually going to help and adhere to it.
And we've got to be careful of unintended consequences. If we tighten up the bars and restaurants more, the controlled environments, they're going to go back into the basements, right? And we don't want to see that.
In turning to public schools, have there been any confirmed cases amongst teachers or students in Delaware?
Yeah, I'll have Secretary Magarik take the specifics, but my understanding is we've had isolated cases, but not connected to one another. In other words, somebody didn't get it in a school environment. Most, again, are transmission that happens outside of the school environment.
Governor, you're correct. So obviously we've had intense coordination with the school districts and the school nurses specifically to make sure that as we're finding out about positive cases in school, we're providing technical assistance, we're providing support to help the schools understand how they have to react, notification of parents, do people need to quarantine, et cetera. And again, the governor is correct. While we have had cases, we've yet to identify that the case was caused by an exposure within the school environment or was spread in the school environment. It just so happens to be an individual who works in school or a child who has gone into school. But again, to date, have not seen evidence of somebody, that person being positive and then spreading it to other faculty members or and/or students within the school environment. But obviously, that's something we are paying very close attention to and want to ensure that whenever there are cases in school, we're deploying all of the public health resources to support those individual schools to, again, work through it in the way that's best adherent to public health guidance and safety of students and teachers and other school members.
Which, of course, underscores the need for those protective measures, distancing, plastic separations within the schools, mask wearing among students and teachers and staff, because it comes, we know, with respect to the nursing homes. It's a similar thing, obviously very, very different in terms of the vulnerability of the populations there.
And since it's primary day, Governor, I was hoping you could tell us who you voted for the city of Wilmington and county exec.
Well, I have not voted yet, but I was out early this morning going around to the polls, and I can share some observations. One is it was very slow, and that's because I understand from the Department of Elections, they were sharing with all the campaigns, 62,000 Democrats had already voted by mail, which is frankly more than most primaries, and you still had 1,000 still voting, and a significant number of Republicans, I didn't pay as much attention to that, voted as well. So this probably will be the highest turnout primary vote that we've had in the state of Delaware. I remember, sadly, a primary that I was involved in unsuccessfully in 2008, which was the high water mark at the time on the Democratic side again at 71,000 who voted that day. We're gonna pass that, almost reached it in absentee balloting. So the point is that vote by mail works. A lot of people took advantage of it. The demographics of that, overwhelmingly, those who voted by mail already were people that are 60 years old and above. The next slice down was obviously, and then younger voters much less so. And so it's, I think it's going to prove to be certainly critically important, allowing people to vote safely in the pandemic situation. And then as a matter of democracy, just having more people the access to vote.
Just to follow up, can you say who you plan to vote for?
Well, I can tell you this. I was quoted in one of Mayor Perzicki's lit pieces that my wife and I were supporting him for mayor. And that's all. The rest is a secret ballot.
Okay. And finally, you touched on it, but with the November election coming up and a lot of concerns nationally about not finding out the results on election day, what does Delaware plan to do to make sure that all of the ballots are counted in an efficient process?
Yeah, so one of the things that I've been saying since the beginning of this pandemic, we've had lots of local cities and town elections, we've had school board elections. Since I am on the ballot, I've taken kind of a hands-off approach to it. Now, I have staff that coordinate with the Attorney General's office mostly, and Anthony Albans, our elections commissioner. By the way, I think he's doing an outstanding job. We, under executive powers, we did allow some of the towns to vote by remotely by absentee, no-fault absentee. But I was uncomfortable with doing it that way for the primary. So the legislature passed a bill that permitted vote by mail for the primary and for the general election. And I did take a meeting with the Postal Service locally, regionally, to understand how those votes will be processed. We are a ballot in hand state, meaning by 8 o'clock tonight, all primary ballots have to be in. the Department of Elections. If you didn't get it in by mail, you could hand deliver it here to a drop box. And so our efforts have gone primarily into communications. Here's how you do it. Everybody got a notice in the mail. If they wanted to vote by mail ballot, they could ask for one. And on our side, over 80,000 asked for a vote by mail ballots. That's an incredible number. So I just need to continue to talk about it's a safe way to vote. If you're going to do it by mail, you got to make sure you get it in by the Friday before the Tuesday election. That was a very strong recommendation from the Postal Service. Could they count it or get it in by Tuesday if you got it in Saturday? Maybe, but don't take the risk. We felt comfortable. I felt comfortable. Anthony was on that call as well, from what we heard with the Postal Service. I don't have any question whatsoever about, in fact, I'm allowed Secretary Magarik to, if she would like, to explain her experience, that there's going to be any double counting, because the people at the polls, they know that you requested a ballot, and if you show up and try to vote, they say, well, you requested a ballot, did you send it in? And I have at least one person here who was quizzed to that.
Health and Social Services and Elections.
Calling on some prior background experience. So yes, I was not sure, given the pandemic, what today would bring. And so a couple weeks ago, or actually longer than that, I had requested an absentee ballot. I do live in a newer neighborhood. Unfortunately, sometimes mail gets lost. I never received the ballot. Again, that's not unusual in my neighborhood. So I wanted to vote, and I went to the polling place this morning, and the lovely and very accommodating volunteers politely said, ma'am, we already sent you an absentee ballot, and we actually have to call and verify with the Commissioner of Elections office that the ballot had not been received before we're permitted to let you vote. And so I stood there, and they got on the phone, and they talked to them, and they verified, thank goodness, that no one had found my ballot and cast it. So I was permitted at that point to move forward with in-person voting.
So bottom line is, I have confidence that Anthony and his team are doing it right, that we're not double counting ballots, that we're efficiently processing them, we're giving people the opportunity to vote by mail, and it's incredibly effective, particularly when you have a COVID-19 pandemic underway.
Thank you.
All right, this first question is from Amy Cherry at WDEL. Is the state expanding its investigation into the organizers of the Bridgeville Rodeo? We have reports the organizer has attempted to get special event liquor licenses through various nonprofit organization names. What will you do in the future to prevent illegal gathering?
Yeah, first of all, this was a disaster, as Dr. Rattay characterized it last time, potentially a super spreader event. We have got the word out that anybody that was at that event ought to get tested. We have fined the person who sought the permit to have the event for misrepresenting it and for allowing it to get out of control. And yes, we've got to be able to prevent these kinds of events from happening in the future, and the way to do that is to have consequences when it does happen. I don't know that we're aware of these other things in the question, but the point is that these are events that can't happen, shouldn't happen, and people ought to be punished when they do, so that we doesn't happen again.
The next question's from Sean Green at WDEL. What are you hearing from school communities after the first week of districts in hybrid and remote learning models? Are you concerned Delaware is becoming a state where if you want your student to have an all-in-person instruction, they'll have to pay private school tuition?
Yeah, I've heard some pretty good feedback, mostly from parents who were satisfied, or at least happy with the changes that districts have made, and teachers in adapting to a new kind of remote learning environment. Obviously, they were forced into it pretty quickly back in the spring, but there's obviously been a lot of preparation over the summer, and I think by and large, teachers and staff came back with a better approach to engaging students, to getting their material across, to working with the content. And so I give kudos to districts and schools. I'd like to see more children in at least some period of time during the week, and we've got several school districts that are working through that. The other districts that are fully remote now, they only have a few more weeks to go, then they're going to move into more hybrid models. So I think that we'll see that. And with respect to the reference to the private school, I think we'll learn from the challenges and successes of private school and how they've been doing with, again, more of a mix, more in-person instruction than remote instruction, but again, with all the protections, separation of desks, lining them up in rows, mask wearing of teachers and students, plexiglass separations, all that kind of things. A lot of effort went in, and a lot of logistics to the geometry of classrooms, the science of disease transmission, and the attention to detail with respect to school nurses and administrators in terms of folks that have turned up positive coming from the outside. I don't know, Secretary Magarik, if you want to add anything to that, but I've been generally pleased. I think we've made progress, but my goal, and I think everybody's goals, is to get children in classrooms in front of teachers for in-person instruction.
I think, Governor, you covered it, and just as you said earlier, based on the prior question from Meredith, because we have seen individuals come into school and find out that they're COVID positive, it just again underscores all of the public health, the importance of all the public health guidance and why we need to utilize all the tools available to us to ensure that if somebody does become positive, that we're able to quickly isolate that person. Other individuals are able to be tested, and hopefully exposure and risk has been limited by the face coverings and the physical distancing.
And I think the key there, again, is to be guided by the science and the public health, appropriate public health pandemic prevention, procedures, and not by fear, or that kind of thing, which, is understandable. We knew that people would test positive. The question isn't so much that, it's where that transmission took place. Is it happening in the school? Or are we taking appropriate measures to protect teachers, particularly those with pre-existing health conditions, and students as well? And to get across the message that everybody has to follow the restrictions outside of the school building, in their social environments, in their movements around the community.
The next question's from Doug Rainey at Delaware Business Now. Are you satisfied with the University of Delaware's testing policy that seems to rely on tests made prior to arrival on campus versus regular tests offered by Delaware State University in light of the recent uptick in cases?
Yeah, I don't think the uptick in cases has anything to do with the testing piece of it, and I'll let AJ talk about that. Again, from everything that we know from contact tracing and from observation, it's these off-campus social activities, super spreader events, that's causing the uptick in cases. And it's important to have a rigorous testing program and protocol to be able to identify that spread, and we're working on doing that. I think we're making progress in a mixed scenario there in both cases, both UD and Delaware State.
No, so Governor's right. Both Delaware State University and University of Delaware have been working with public health for some time now. Delaware is offering, so the University of Delaware is offering testing as well. They're doing about 1,000 tests a week, so they will do that for their faculty, staff, and anybody in the member of the Delaware community, the University of Delaware community. So just if you're a student that returned to Newark but may not be on campus, you're still eligible to get their testing. And additional at the university is doing in Newark, We've identified the Hudson State Service Center, which is right on 273 before Main Street, that will be holding testing. As I mentioned before, the Newark High School will be holding a community event on Monday, because it's not just the students, it's that community that we want to make sure we have testing in, as well as some of the clinics on Main Street are doing rapid tests for students as well. So it's a layered approach. We've worked with Delaware State University as well. We're supporting them, making sure they could get through the fall as well.
This is the last question for today from Betsy Price at Delaware Live. With all the Halloween stuff out in stores and fall decorations showing up in yards, will the state restrict trick-or-treating because of COVID-19?
Well, nobody's going to have to buy a mask, that's for sure. I mean, but I don't know. I am the Irish governor that canceled St. Paddy's Day. God forbid that I cancel Halloween. I'm going to defer to Secretary Magarik for this question.
As a parent, I understand the anxiety I've heard from friends of my kids and others. Our goal is not to cancel Halloween like we've done with other holidays that have occurred during the pandemic. It may look a little different. And as Director Schall had referenced, Jamie Mack and his team at Public Health have been working already on guidance to be able to provide to towns and parents and schools and families and everyone who has events planned or is thinking about doing fall-themed or Halloween-themed events to make sure that we can offer guidance that will enable them to do it safely, and that includes trick-or-treating as well. So as the governor said, people, best opportunity people have had to dust off their masks and use them. But again, we look forward to helping people understand how they can safely enjoy the fall season and Halloween.
Maybe we can use it as another way to incentivize mask wearing in our state, because one of the things that, if there's anything that I've learned as your governor over the last 6 months, is that the most important thing that we can do to prevent the spread of COVID-19 is to wear a mask, particularly when you're in public and it's hard to social distance. You really should just wear a mask at all times, because you never know. We're going to have an app now that'll enable you to be alerted if you've come in contact with somebody who's tested positive, who has participated in the program, and so you'll know whether you should get tested and quarantine yourself. But you can always protect yourself and others by wearing a mask, and obviously that's what Halloween is all about. So I just remind folks to act with a sense of community. We really need to focus now on the hot spots again. Our college towns in Dover and Newark, we know the challenge that we face there with college students and off-campus social activities. They know it. We would just ask that they work with us and not have the kinds of events that turn into super spreaders for COVID-19. Try to think in terms of whether or not you would want your younger brother or sister not to be able to go to be in front of a third grade teacher learning how to read and doing basic math because our COVID-19 positive cases were too high and we couldn't allow that to happen. And so we're going to work with the City of Newark, the City of Dover, university personnel, and Delaware State University personnel in coming up with an approach to that will hopefully be more effective. We also need to do a better job in the lower part of our state with respect to some of the public health guidances there. Those numbers there are picking up again. And then finally, today is, as we've talked about a little bit, today is primary day in the state of Delaware. Whether you're Democrat or Republican, you've got a full slate of candidates out there running for office. I would encourage you, if you haven't voted, so many people, over 60,000, have voted by mail. And so if you do if you haven't voted and you're worried about going to a poll because there are going to be a lot of people voting, those people have voted already. And so the crowds are not there like they normally are. It was a really good way of getting people to participate in the democracy in a safe way. And we'll have probably more people that have voted in the primary today, both the Democrat and Republican primary, than have ever voted in a primary before in the state's history. And hopefully as we move into November, the same situation. It's a beautiful day out there. The weather's beautiful. The polls are open to 8 o'clock, so if you haven't voted, go out and vote, whether you're Democrat or Republican. As said, full slate of candidates on both sides of the aisle. Thanks for joining us today. We'll see you next week.